Hi, my name is Nermeen Ahmed. I'm a trust grade doctor assigned to the acute admission wards here in Berrywood Hospital, so that's the adult general psychiatric patients. My role is I'd be the first one the patients see when they come into hospital, so I'd be in charge of clerking the patients, doing all of the risk assessments needed, as well as the physical and mental health assessments. Then I do liaise with the consultant, the MDT, on the ward to make a management plan for the patients while they're being an inpatient, and then to arrange for a possible safe discharge at the very end. So originally I'm from Egypt, and I came from a different specialty because when I graduated 2 years ago I worked in cardiology for around 6 or 7 months. The NHS is completely different from other health systems even outside of the UK. They have much resources that we have over there. Patient safety and care is a priority, and having MDTs who are very dedicated to patient safety, trying to get proper management plan and using all the available resources, it's very magnificent. And I'm not in contact with many mental health services from back home. I volunteer, but I never actually worked. But I know the support they get, whether as an inpatient or as an outpatient as well, it's beyond spectacular. Well, first when I came to work with NHFT, I was a clinical attaché actually, and that was in June 2021. At the time, being an IMG and coming here to do my Plat 2 exams and trying to get my GMC registration, they were kind enough to offer me the accommodation here. And then when a vacancy was available, I was encouraged to apply for that position, and then I was supported trying to get my affairs sorted in place later on. So they helped me by referring me to tenancy agencies here that would help me get my accommodation sorted in the future. HR here was very kind to be able to work with the sponsorship certificate, which is a very important document that we need as IMGs to be able to work in the UK. Well, Northamptonshire is a very quiet place, so it's more on the countryside wise, and for me personally, this is my preference. So between choosing a big city like London or Manchester or even Liverpool, where there's a lot of people and a lot of activities to do, I'd rather stay on the quiet side of the UK, to be honest. So yeah, and plus it's a very easy commute to London, so when I do miss this part of my life, it's just a 1-hour train to London and then I'm back in there. Well, if I want to take it from the very beginning, when I first came in contact with an NHFT in June, I could tell that they were an IMG-friendly trust. With the support I got as a clinical attaché and with the support I get now as a trust grade, especially during the time I first began because of COVID, I came from Egypt, and at the time it was a writless country, so I had to come and quarantine in a hotel for 10 days in London, and that was part of a financial burden, so NHFT was kind enough to support me relocation fees and to reimburse me for that. And then coming to work here, the support still continues, whether it's from my consultants, from the staff on the ward, or even from my other colleagues on other wards. You don't have to be shy to say that you don't know and to ask for help, because they will be there for you. They will encourage you to progress with your career as well. And I think this is the least I could say now for why it is outstanding. There is much more to say, but I think this is the most part that I'm grateful for. I know it's very intimidating leaving your home country and coming to work in the UK. It's a new system, new quality of patients, and new different type of mental health system, especially with the NHS. But I consider myself lucky that my first job that I got to get in the UK was with NHFT because of all the support I was able to get. All the progress I've made in my career just working here for I think 3 or 4 months so far. It is an experience that I would encourage anyone who's able to apply for any vacancies, that it is put out there for people to grab. You will feel like you're part of a family here as well, so you're not going to feel alone anymore. So I think the best thing I like about working with NHFT is, apart from the support that you get, they do encourage you to be better at your job, better at the knowledge that you gain from the teaching programs that we have here for the trainees as well. and being able to get clinical supervision with the consultant, and even not just your consultant, being able to have a mentor who doesn't necessarily have to be your clinical supervisor. It will help you to progress in your career and then aim for even more and bigger things in the future.